Congratulations on graduating nursing school. It is a huge achievement. You're one step closer to having the letters RN behind your name. However, your work is not done yet. It is now time to prepare for the NCLEX, which I know can be daunting and scary, but it doesn't have to be. Today, I will be teaching 6 important tips in your preparation for acing this test. The first thing you should do is schedule your test date for 1 to 2 months out at most. There are a couple reasons for this. The first being that the longer you wait to take the test, the more you will forget, which will decrease your chances of passing. The second reason is that by having the test date set in stone, it will give you a pressure to study and help you avoid procrastination. And worst case scenario, you can always reschedule the test if you don't feel ready. Keep in mind that although failing is a bummer, it is not the end of the world. You can study some more and try again and pass the next time. Failing the test does not make you a bad person or a bad future nurse. There are many nurses out there who have failed more than once and ended up being great nurses. I've worked with plenty of them. The second and most obvious one is to study.
Study? What are you doing?
Many students who take the test without studying end up failing and putting a halt to their momentum. They go into it thinking nursing school has prepared them to pass, and while this may be true for a few select people, it is not the case for most. You must commit to a study plan to ensure the highest chance of passing the NCLEX. The key to a great study plan is that it needs to be consistent and have structure. You do not have to study for 10 hours a day like you did in nursing school, which is great. Just a few hours a day will be enough. The third and arguably the most important tip is to use active recall methods when studying. Active recall is a method to activate your memory instead of just rereading something passively. By doing this, your brain is able to move information from the short-term to the long-term memory.
His name? What's his name? I got nothing on a name.
Some of these methods you may already be familiar with. The first being flashcards, the second, teaching someone else, or the third, practice questions. Of course, each one has its own pros and cons. The pros of flashcards are that they are portable and easily accessible while also cheap and easy to make. The cons are that they are not great for complex concepts and can be quite boring for some people. The pros of teaching someone really solidifies the information and can also identify the gaps in your knowledge. The cons are that it's time consuming, which can take away from your own studies, or there may be a need to tailor your teachings to the listener's learning style. The pros of practice questions is that it familiarizes you with how the actual NCLEX test questions are like, and this results in less stress of the unknown on test date. Additionally, it shows you which topics you are especially weak at, and then you can focus your studying time on those specific topics. In my opinion, the only con is that they can be long and time consuming. My personal favorite is, of course, the practice questions, and not just doing them willy-nilly, but ensuring to read the rationale of every question you were unsure of or guessed correctly or got wrong. If there's one thing that you take away from this video, it is to read the rationale of practice questions. This is because the rationales go past simple memorization and enters the realm of understanding. Remember, memory is temporary, while understanding is forever. While there are some cases where simple memorization is necessary, such as normal electrolyte values, a lot of other cases require fundamental understanding of the concepts. For example, we can remember at face value that someone who is having severe diarrhea and vomiting is at risk for heart arrhythmias, which we have the chance of forgetting later on. But if we understand why a person who is having severe vomiting and diarrhea is at risk for heart arrhythmias, then we are less likely to forget. The explanation is that vomiting and diarrhea causes excess electrolyte loss, which includes potassium, and potassium plays a crucial role in electric signal functioning of the heart, and if it is abnormal, can lead to arrhythmias and other problems. Remember, once you pass the NCLEX, you'll be working with real patients, and they will be depending on your knowledge and understanding of the human body to help save or heal them. It is no longer a lab simulation, so it is vital that you take your studying seriously. The fourth tip is NCLEX review courses that are usually a week long and can cost anywhere from $100 to $500 or sometimes even more. Many students opt to take an NCLEX review course which focuses on reviewing the core systems of the body. I myself took one local to my area that was popular at the time, but in all honesty, it wasn't really that helpful and I could have done without it. The reason is because you've just taken a 4-year-long review course, which is nursing school. If you went to a fully accredited nursing program, then you should be prepared in regards to content and material. Now, if you went to a fake program in Florida, well, you've got bigger problems to deal with other than choosing an NCLEX review course. The 5th tip is tutoring. Tutoring is an essential tool at your disposal, and if you are financially able, you should definitely pursue it, especially if you are struggling. The pro of tutoring is that it allows you to get out of your own head and lets you gain a whole different perspective that may just be better than the one you currently have. Tutors have a wide variety of strategies they can teach you that will help you excel in your studies. The only con of tutoring is that it can be pricey depending on where you live, though sometimes online tutoring is a more common option now too. Typically, the cost can range from $50 to $100 an hour, which can be steep for some people, especially considering the recommended amount of sessions for optimal effectiveness is 5 to 10 sessions. I actually plan to start tutoring nursing students for the NCLEX exam, so keep an eye out for an announcement. The 6th and final tip is allowing yourself to relax and recuperate. You have to rest just as much as you study so that you don't get overwhelmed and burnt out. Pro tip, do not study at all the day before the test or the day of the test. Allow your brain a break so it is fully rested for test day. The finish line is just up ahead. Finish strong to achieve the 4-year-long goal you've been working on towards relentlessly. I believe in you, you've got this. If you have any other tips you found works for you, leave them down below so other students can learn. See you in the next video.